Alterations in immunity and hematology, disorders of the lymphatic system. The lymphatic system is a network of vessels that transport lymph, which is a watery substance from the plasma, and it transports it to the lymph nodes that will then trap and destroy and remove infectious microorganisms, cellular debris, and cancer cells. Lymphedema is an accumulation of lymphatic fluid because of an impaired lymph circulation. We have a primary lymphedema that is congenital, or secondary, which develops as a result of other disorders or the removal of a cluster of lymph nodes, such as with a mastectomy. These clients will have swelling of the affected area. That skin becomes really tight, firm, and shiny in the later stages. We have what we call that brawny edema that we cannot indent. There may also be weeping or oozing from the tissue, and it becomes very vulnerable to infection and injury. It is important that we treat the symptoms. We elevate. These clients should be wearing a compression sleeve or stocking, and they may require a complex decongestive physiotherapy. We need to be sure that we're doing a good skin assessment. We're encouraging exercises to help improve circulation. We're encouraging that elevation and wearing of those compression garments. We may have to place mechanical devices, definitely provide emotional support and client education on skin care. A woman undergoing a modified radical mastectomy is at risk for ineffective tissue perfusion and lymphedema. A nursing intervention to prevent compromised flow of lymphatic fluid to the upper extremities includes what? Supporting and elevating the arm on the side of the mastectomy. The characteristics of infectious mononucleosis includes all of the following except the incubation period is 10 to 14 days after exposure. Actually, it's 30 to 50 days. Lymphomas refer to a group of cancers that affect the lymph system. Hodgkin's disease will produce an enlargement of lymphoid tissue, the spleen, liver, with invasion of bone marrow and lungs. The cause for this disease is unknown, but the Epstein-Barr virus may cause mutations in some lymphocytes, creating what we call malignant Reed-Sternberg cells. The Epstein-Barr virus is going to be the virus that causes mononucleosis. These clients have that presence of Reed-Sternberg cells in the lymph nodes. They do have painless lymph node enlargement. They may have epigastric pain and fullness, weight loss, anorexia, fatigue, and weakness. They may have a low-grade fever, pruritus, and night sweats, anemia, thrombocytopenia, and poor resistance to infection. Remember, the lymph system is involved in our immune response. We diagnose it by looking at CBC, blood chemistry tests, a CT scan, MRI, a lymph angiography, and/or chest x-rays. We can do a laparotomy, bone marrow aspiration, or biopsy, and then we stage it. It would be staged 1 to 4 and classified into A or B. We can treat it with localized radiation, chemotherapy, which would include the anti-neoplastic drugs, and potentially antibiotics if infection is present, and doing a stem cell transplant. Then we have non-Hodgkin's lymphomas. This is going to be a malignant disease that originates in the lymph glands. The difference between the two is Hodgkin's lymphoma has the presence of the Reed-Sternberg cells. Non-Hodgkin's lymphomas do not. So this is caused by a genetic link and or some environmental triggers. It is classified as indolent, which is going to be asymptomatic and responsive to radiation or chemotherapy, or aggressive, which has a shorter onset with acute symptoms. These clients will have lymph node enlargement, lymphoid tissue biopsies, and or additional tests for staging. Again, we treat this with radiation, chemotherapy, immunotherapy, or monoclonal antibody therapy. We can also do bone marrow transplant and stem cell transplants. So very important as nurses that we encourage extra fluid intake and monitor the clients who are receiving chemotherapy and radiation therapy for potential adverse effects and provide appropriate treatment and support. A client diagnosed with Hodgkin's disease is at risk for infection related to immunosuppression and drug or radiation therapy. To assist the client to remain free of infection, the nurse should implement which of the following? One thing I want to point out as you are reviewing the responses to this question, the question is asking how we help the client remain free of infection. These responses are very good responses, but we want to help them remain infection free. So we do this by restricting visitors with infections from contact with the client. A client with non-Hodgkin's disease is admitted to the hospital. In discussing the client's care with the nursing assistant, which nursing explanation is most correct in relation to the medical management of the disease? Radiation and chemotherapy.